Uh, so is about the psychosocial aspects in palliative care. We'll be learning what is psychosocial assessment and why it is important in palliative care, and how you all can learn and produce this on the palliative field. So I will be sharing my slide. Can I, Sangeet?
No sound.
Sangeet?
Am I audible now?
Yes, you are.
Yeah. Now you're audible.
Okay, thank you. So yeah, so this is the topic, psychosocial aspects in palliative care. So before going to the session, do anyone have any idea about what this class will be like? What are we going to discuss? Though we are saying the topic as psychosocial, what will be the content? Or anyone curious about the session? Something like that? No one has no idea about psychosocial. At least from the term psychosocial. Uh, okay. So about the emotional aspects of patient and attendant. Okay. Thank you, Kiran. Anyone else?
The psychological aspect and the social aspect.
Yeah, yes. So, as the terminology says, we are going to know more about the psychological and social aspects, and how much we are going to, like, how much these terms will help, especially in a field of palliative care, and how we are going to assess the psychological as well as social impact of each of our beneficiaries who are seeking our support. So, moving forward, Mm, I know you all are very, very familiar with this definition. What is palliative care? So, is an approach that improves the quality of life of patients and their families facing problems associated with life threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, which includes physical, psychosocial, and spiritual. So, yeah, I will be highlighting the last two terminals, that is psychosocial and spiritual here. So, before that, is it important to know all these aspects in the palliative field? Why can't we only focus on the physical aspects? Why do we want to go behind this psychological as well as social aspects? Because as palliative care patients, they will be obviously with the terminal illness and all. So, and for that, we are giving them which much more. We have to give much more attention to the physical aspect. So, is it important to look into the psychosocial aspect, and also how much important that is? Any answers from your side? Palliative care includes four aspects. Oh, who is that? Ashwadi. Okay. I think you people have gone through that four aspects. I think so. It is important. Before sessions might have taught you. So why it is important? My question is, why is it important? Yes, we do go follow with the other four aspects, but why psychosocially important? Anyone? Any answers, please? Come on.
We need to provide holistic care. When we provide only physical care, still all their emotional problems are unsolved. So I don't think they will be. It will be improving their quality of life completely. We can only if we focus only on physical, that part alone will be coming up. Still, they will be having a lot of issues.
Yes, exactly. So we will be while focusing on the physical aspect, only one side is being covered. The rest of the sides are being unfilled or uncovered. So when we say care or total care, it doesn't mean only just one aspects. It should cover the whole other three aspects, and that is also similarly important to the physical aspect too. And while we focusing only on the physical aspect, maybe though they are saying that okay they are having some sort of relief, that relief may not be a long lasting one. In between they will be feeling some sort of irritability or some sort of pain which is due to the other three aspects. So it is important to consider and to evaluate the three aspects, that is the psychosocial spiritual aspects as like the physical aspects. Kiran also have answered like because psychosocial aspect will help in improving the physical well-being and mental well-being. Yes, because one aspect is focusing more on the physical, while the rest of the three is focusing more on the mental as well as that particular person's social well-being. Okay, so moving forward, this is a small article which I have taken from a journal of palliative care. So this article is about is written by a nurse. Her name is Irene T. Tanchel. And this sentence, like the black bolded sentence, had some kind of importance, I think. That is, the quality of life for patients and the manner of their dying is sometimes more influenced by psychosocial factors than by physical status. Okay, so what she's explaining is that sometimes even the dying is more influenced by the psychosocial factors. And individuals dying more than the physical, it is more connected to the psychosocial factors. So yeah, it is important even for the EOL, end of life patients, to be considered and to clear off these psychosocial concerns of those palliative care as well as normal people's. So this I have taken from Indian Journal. Like the details have been given on the right side. You can just go through that also if needed. Okay, so it's just a small article which explains the importance of the psychosocial in our palliative care. Moving forward, um, so these are the few reasons why we are saying that this is important. I will read out. First one is living with a life-limiting or life-threatening illness or the awareness of approaching death causes unique stresses or challenges. So it is 100% assured that they will be going through some sort of stress or some sort of challenge, because one fine day they are getting to know that they have been diagnosed with this kind of disease, and this some disease which comes under this life-threatening illness, and their days are countable. So if a person is going to hear, like you just imagine that you're going to hear this kind of news from a doctor, so obviously you will be having that unique stress or unique challenge, right? So of course, even our beneficiaries also will be having this kind of stresses when they get to know or when they get the awareness that they are in face to face of this kind of illness, which is 100% sure. So second point, it says that understanding these factors related to a patient's quality of life is essential in providing appropriate care. So for providing the appropriate care, we need to know the underlying factors.
आज मैं चावल नहीं खाऊंगी आज 2 बार
Maybe
चावल
like the patient may saying
खा लेगी।
pain, but we are the persons who has to identify from which aspect is this pain is coming. Is it a physical pain, or is this pain coming from a psychological problem, or is it due to the social impact, or his or her spiritual concern? So that factor, that underlying factor has to be assessed. Then only we can provide that appropriate kind of care. Third one is, as palliative care is a life affirming approach, the psychologist similarly focus not only on identifying and addressing distress and pathology, but also on enhancing well being. This includes validating individual and family strengths and promoting sources of meaning and purpose supportive of the family system. So basically, if on a family where one of the breadwinner has diagnosed with a life-threatening illness, obviously the balance of the family will be upside down. So what we have to do is that to enhance the whole family, not only that particular patient or the particular person who has been diagnosed, but the whole family has to be enhanced. For that, maybe it may be like providing them a family strength through some sort of uh, mental health kind of counseling, or giving them motivation or mental support, or through providing some sort of resources which is needed at that particular point for this particular family. So it depends on individual to individual, and we are the ones who have to identify and address the distress. Okay, and that is not only to the particular person, that is not only to the particular patient, but to the whole family. Okay. And fourthly, psychosocial support helps in reducing the level of actual and perceived stress, and in preventing adverse psychological and social consequences amongst disaster affected community. So we might have seen that the palliative care patients are also being when they reach to a point, they have been diagnosed with some kind of mental issues, that is depression, anxiety and all. So if we are not valuing, or if we are not evaluating these problems on the earlier stage by identifying and assessing and providing intervention, then when it goes in an adverse situation, like there are possibility of getting such kind of psychological as well as social issues, which again they have to take a proper treatment. So before that, like we used to say, no, prevention is better than you hello, is it audible? Hello?
Yes, ma'am.
Yeah, okay. So we used to say, no, prevention is better. So like that wise, just want to know, we just want to understand their psychological aspects as well as their social concerns by preventing such kind of diseases and disorders in adverse situation or in future times. So by all these reasons, we can say, or we have to say, that psychosocial care is more important in a particular field called palliative care. Okay, any queries or any doubts in this particular slide? Can I move forward?
Yes, ma'am.
Okay. So yeah, always saying about the four aspects. Like before, someone said like palliative care. In palliative care, psychosocial is important because we used to go through the four aspects. So I'm taking that point itself. Like we have to assess the whole 4 points to know what the pain is actually, because here we do have a patient in our IP setting who like most of the time he will be having severe pain which is 10 out of 10, even though providing all the medications and painkillers. It will be just for a duration of 1 hour or 1.5 hour. Again he will be saying the same pain again and again. So for this kind of situation, we are lacking something. Like he is telling pain again and again, and there are some reasons which we didn't identify or didn't assess. So it is because his underlying family issues and was his concern to his mother, which was making him stress inside, which was coming outside as a pain, physical pain. So here, the total pain comes under the all four aspects. Sometimes it's not the physical aspects which only says the pain. The other three aspects also are reasons for physical pain. So when someone comes and says you that I am having such kind of pain in my head, they are having some sort of thoughts which is going on in the, or maybe he is an overthinking person, and because of that he is having headache, which is coming out as a pain. So always remind that when a person says pain, it is not only his physical pain, but also the concerns or the thoughts or the stress which is underlying inside him. So total pain is actually not a subjective one. It is important to assess the physical as well as the other three aspects, which also will be coming out as a part of the physical pain. Okay. psychosocial assessment. So here we were saying all about what is psychosocial, what is it, why it is important, and like how the psychosocial factors affects the physical pain and all. Again, we are going to tell or learn about what is psychosocial assessment and how we are going to take a psychosocial assessment. So, psychosocial assessment is an evaluation of an individual's mental health and social well-being. So we are going to evaluate or identify both the mental aspects as well as the social well-being aspects. So the aim of our assessment is to identify which result from illness, which of the area is affected by illness or will affect the affect the patient's influence for his or her well-being. So if we wanted to provide a better well-being, or also if we wanted to provide the exact area where is the problem, for both of the reasons we should know which area is it. For that we have to take a proper psychosocial assessment. So here basically what we used to do is, the first part is collecting the information. We are collecting more information regarding the mental aspects as well as of the social aspect. And from that, we are going to identify which is the problematic zone. Is it something comes under the psychological aspect, or it's something which comes under the social aspect, which is his or her family, relatives, whatever it is. So after collecting the information, we are identifying which area it is, and then we are honoring the strength, resources, and needed. If some sort of the area has to be strengthened, then we are going to strengthen it. Or if there is something which has to be provided into that, then we are providing the acquired resources for that, thereby fulfilling his or her needs. Okay, so psychosocial assessment is basically an evaluation of both mental as well as social well-being. And for that, we are like, why we are taking that is because we are aiming to know what the correct exact problematic area, and also to identify which area can be like strengthened for his or her well-being. And how the process is, first we are collecting more information regarding both the zones, and from that we are identifying this problem area, and if it needs to be strengthened, then it has to be strengthened, and also providing the resources and needs for it. Okay. So next comes the areas of assessment. Here, these are the 4 general basic areas where we are taking or collecting the information. First comes general area. Here we have few details, that is patient and his family, the insight, family structure, socioeconomic status, environmental assessment, psychological distress, spiritual impact of illness, intervention, and plan. Okay, so these are the basic general informations or details which we have to collect. Second comes the patient and family overview. Here we have basic demographic details, occupation before and after illness, primary caregiver, and the relationship with the patient. Okay. Third area comes the insight zone, whether the patient and his or her family is aware about the diagnosis, about the prognosis, and about the palliative care. Okay. And the fourth area comes the family structure and its dynamics, where we are going to explain the genogram, how the family dynamics basically the relationship, what sort of a relationship is inside their family, is there any support system, and whether is there any history of illness in the family. So these 4 are the general basic areas which we are going to collect on a psychosocial assessment. Is that clear, anyone? Any doubts or queries? Can I move forward?
Yes, ma'am.
Okay. So based on the each aspects, physical aspects, as you all know, we will be assessing the pain through pain scale by interviewing the patient when he or she comes on the OP or IP. which is the physical aspects. Going to the psychological aspects, there we will be assessing the mental health, their emotional well-being. Is there any anticipatory grief, and how do they cope up their problems? Like or each individual has a different way of coping their problem. So we have to know how that particular patient's coping mechanism is, so that we will be able to strengthen that. So these four aspects should be known in a psychological manner. And going to the socio-economic aspects, like whether they are getting adequate food, clothing, and shelter, which is the basic needs, who is the breadwinner of the family, any other source of income is there on their family, any debts are there, social support, which includes government schemes and other local financial support, and are their children are getting proper education or not. So these all comes under the socio-economic aspects. Coming to the spiritual part, how much they are connected with their own spirituality zone. Are they getting the strength and comfort through that spirituality zone? Is they do have any hope or concerns in it? And are they being able to find meaning and joy in their life? So all these four aspects should be covered on the basic area. These are all the things which comes under the four aspects. Okay. Should I need to clarify or explain anything? Can I move forward?
Yes.
Okay. So till here we have explained what is psychosocial assessment, what are the aims which we are focusing on the psychosocial assessment, what we basically collect on a psychosocial assessment, and on the based on the areas of assessment we have divided few details which we have to be more concerned on while taking the assessment. Okay, genogram part. So earlier on the family area, family structure and dynamics, we have explained a term called genogram. So this is the one we are going to learn more in it. So actually, this genogram is a graphical or a pictorial representation of a person and his or her family. That is, by seeing the genogram itself, we can identify or we get the whole history of the family, like who is the patient here and who all are the family members in this family, uh, like how they are connected with, like how the dynamics totally in it, and their name, their age, their education, who's the breadwinner, how their emotional strength are. So all these details are explained in a simple genogram or in a pictorial representation. So by seeing that itself, we can understand who all are the members and what all these details are. So this was introduced by Murray Bowen, and as I said, it's a graphical representation of a person's family over at least 3 generations, which tell us about. So here that particular beneficiaries 3 generation will be explained on that particular genogram, and so that we can get the history of the illness also. And here we will be mostly focusing on what the structure is, the dynamics, the strengths, the resources, etc. And the information which is included in this genogram will be the name, age, education or occupation profile, and the emotional relationship. Okay. So these all are the small symbols in which we are going to draw this genogram. So with the symbols only, again, we are going to make a genogram. Okay. So basically you have to be more thorough in these symbols, and like what all things represents what all. It should be like purely thorough on this. So the first one is the square one, which is the male, and the circle is the female. Okay. So the square is the male and the circle is the female. In between a line which explains that they got married. And in that line, one slash had drawn, which explains that they have been separated. And if this slash is a double one, then they got divorced. Okay. So square is a male, circle is a female, connected with a straight line, which explains that they got married. And in between a slash is drawn, which explains that they got separated. Two slashes are there, again, which explains is they got divorced. Okay. So coming to the right side of the slide, here, this explains the how we draw the children. So first one, a circle is there with a straight as well as a dotted line, which explains that it is an adopted child. Okay. Next comes foster child. Do you know what is foster child?
Yes, we know.
Okay.
The child who's been adopted.
Pardon? I didn't get you.
Foster child, right?
Yes, yes, yes. Who's a foster child?
The one. The one who is supported financially by not from the family members.
Okay. So basically, the primary difference between an adopted child and a foster child is the adopted child has been taken by the parents with all the legal things. That is, they have been permanently taken care of. But coming to the foster child, it's like some sort of organizations will be there who will be taking care of till 18 years of age, like that wise. So it's a temporary support actually. But adopted means they have taken that child forever, like that wise. Okay. So this is how we draw the foster child, like dotted lines with, if it is a male, then it will be a square, and if it is a female, then it will be a circle. Then here we can say that it's like pregnant, or it's on the pregnancy period, and this is the stillbirth, like the child has got been like the child had passed away. So this will be like after delivery, or maybe on the process of delivery on that time. And this is miscarriage, which is miscarriage and abortion is similar to, like before that delivery itself, the child has got expired. And here is the twins, where from a small dotted line, two lines will be there. It can be either circle or square, or one circle or one square. So this is how we draw symbols, and these are the symbols which will be present on a genogram. Okay. Moving forward, this is the emotional explanation. Like if it is a straight line, we can say that it is a normal plane relationship. And if it is a dotted line, we can say it's a kind of a hybrid relationship, like it's not that much deep and not that much formal too, like kind of a high bite. This is a double line or a darkened line, which explains that they are very much close, like those persons are very much close or very much in intimate relationship. And here it will be a hostile one, and which is like some sort of conflicts are there inside those, in between these two people. And this is a kind of a violent relationship, like abusive, we can say it's as a kind of an abusive one. Okay, so you can just focus only on this table, because while we go to this, we like there is some sort of confusions may happen. So just focus on this, like the straight line, plain or normal, dotted line, friendship, or a close one, but not too close to. And this is a very closed one. This is a hostile, or there is some kind of conflict happening between these two people. And this is a violent or a kind of an abusive relationship. Okay. For even for sexual abuse, we can draw this line. You can a bit more darken it. Okay, and this shows that arrow, like from where to where is it going. Like the arrow depicts the wave or flow of energy, like from whom to whom is the relationship. If I'm drawing an arrow here, then I can say that there is a violent relationship happening from this square to circle. Okay, any confusions? Or can we go forward? Because next comes the original genogram of a particular family.
Yes, ma'am.
Okay.
Yes, yes.
So this is the basic genogram here. And Sindhu is the patient here. Okay. The dark one is our patient. And we have 3 generation here. So can anyone give a try on this? Just focus on the symbols, the cross line, and on coming on to children, like it starts from the dotted line. Getting it a bit easy. A simple genogram, this is. Can anyone give a try?
Can I try it?
Yes, please. Sure, sure.
Yeah. The square with the cross is stillbirth. Is the same thing you're asking?
No, no, like
Am I
just
correct?
explain this family genogram. So I can give
Oh,
a
okay.
start like Sindhu is our patient here. And now you can explain this family by seeing the genogram.
Ma'am, Sindhu were married 2 times.
Yeah.
Okay, so the first one, 45-year-old Shaji, and then Sindhu. Their parents are not alive, and they have 2 kids. One is Amal and second is Vimal.
Yes.
And Sindhu is the patient. Her previous her hello.
Yeah, yeah, yeah. Now you're audible.
So the last husband is
Mhm.
no more, and that is and that's their parent, I guess. The Mohan is dead. Leela is still alive and a homemaker. And the Raju and Sindhu have 1 kid, Saran.
Mm.
Is that correct?
Okay. So any comments for this from your side?
Mm,
Should anyone
no,
want to
ma'am.
add to it or want to correct anything?
Amal and
feel
Vimal
like
are
that,
twins.
ma'am.
Who is that?
I think Sindhu is married to Saju Mission and she had 2 children with this first 45 years with that man. And Raju, she had 1 children. Then Leela is maybe a parent, mother Mohan
Mother
may
of-
be her father-in-law.
Mother of whom?
Sindhu's parents, Leela
Okay.
and
Yeah,
Mohan.
yeah. Okay. Yeah.
Yes, then
Yes.
their grandparents were Laila, she's died. Then Kumaran, he also died. I think so, according to her.
Okay. Okay. Anyone?
That Shaji, ma'am.
Yes, please.
Actually, it starts from here that Mohan and Leela has Sidhu, their daughter, and she got married to the Raju Kuli, and he passed away. And from him, she got one daughter. Then she remarried with Kumaran and Leela's son Saji, and with him she got two twins, Amal and Vimal, and she's sick. That's right.
Yes. Okay. Anyone, please? Was her reply? Was her answer was right? Like someone in between came.
Her answer was right, ma'am, but
Yes.
the Shaji's parents are no more, and
Oh,
Sindhu's father also no more.
Yes. So I think now everyone got clear. I think so. So it is easy to start from the patient. Like whenever we start the genogram, if he says that Sindhu is our patient, she is 14 years old. Her parents are Mohan and Leela. Mohan had got expired, and Leela is the homemaker. Sindhu got initially married to Raju. Then he got passed away. He was a coolie worker, and in their relationship, they had a son. His name is Saran, and he is studying 11th standard. Then, secondly, she again got married to Shaji. Shaji is the son of Kumaran and Laila. Both of them got expired. Then, in their relationship, they had two twins, who is Amal and Vimal. Both of them are studying on 8th standard. Okay, so like when we start from our patient, like it will be more easy to convey the information. So you can like at whatever times you can start from a patient, like from here you can go to the first generation, then their generation, and then to their third generation. Okay, so I'm going to spice this up. Here I have added few more emotional relationship here. So this is same Sindhu, same Shaji, same Raju, same Mohan, Leela and all. But a few more members have been added also. Their emotional relationship also is being added. And yeah, who can give a try on this? It's easy one. The thing is like just want to focus on their emotional lines. Rather than that, everyone are the same one only. Come on, who can give a try? No one? Yes.
It's like that. Sindhu has got a relationship with her son, is a good, and with her siblings, that is her brother, sister, and their Leela's children, they and all, her relationship good. Green line is there. Again with her one more Sudha, her relationship is good. At the same time, when Sindhu married her second husband, her relationship towards that stepson, the first husband's son, the relationship is not good. It is a violent relationship. Then some, and with Sindhu's husband's relationship with Saji, that is his relationship with his children. Okay, that's a dark line is there, I feel. And again, his relationship towards his parents, his sister and Subhas, his brother. And with them, he also is not in good relationship. That's what I feel. There is some emotion.
Okay. Anyone? Anyone else want to add anything to it or want to correct anything? Can come up. Anyone else?
Ma'am, the Veena, wife of Subhash, is having a hostile relationship with Shaji,
Yeah.
and Subhash is having a hostile relationship with Shaji. Shaji
Yes.
is having a hostile relationship towards Sharat.
Yes.
Vimal and Sharat are having a close friendship.
Vimal and Sharath having, yeah, a close relationship. Then about the green lines.
Hindu and Bindu are having strong relationship with their sister Sindhu.
Yes. And one more green line is there.
Sindhu is very close with her first son from Raju.
Yes, Sharath.
Yes.
Okay, very good. So, yes, Sindhu, here two more members are being added, which is Indu and Bindu. Both are her elder and younger sisters. Indu is married to Mani and Bindu is married to Ravi. So, regarding the relationship between these three sisters are like they are in a very close, intimate relationship because we can see that there's a green light and that is darkened light. Okay. So, and also like there is one straight line which is a normal line which is seen between Mother Leela and our patient Sindhu. Okay, which is a plain normal relationship. Coming to Sindhu and Sharath, they are also in a very intimate close relationship because a green darkened line is visible over there. And Sharath is having a close but not that much intimate relationship with elder twin women. Okay. But the relationship between Shaji, who is Sindhu's second husband, is having a very strained or an hostile relationship towards Sharath because the arrow is pointed towards Sharath from Shaji to Sharath. Okay. And here we can see that Shaji has one elder brother who is Subhash and he is married to Veena. Both of them are having a hostile relation to Shaji and Shaji is having a normal relation to both of his children, which is Amal and Vimal. Okay. So with this, we can identify the emotional relationship of the family. And there is a small circle in this diagram, in this genogram. Did you identify? So what this circle explains is that these all are the members who are living on a same family or in a same home. Okay. So Sindhu, a husband Shaji, these three children all together are living on a same home. Okay. So this is how we draw and explain a genogram. And with the genogram, we will be getting all these information, like who all the members are there, who all are who all got expired, what sort of a relationship all these families having, whether it's a very good relationship or any hostile one. So everything can be identified and explained through this pictorial representation. I hope it's clear for everyone. And shall I move forward? Yeah, can I?
Yes, yes, yes,
Okay.
ma'am.
So till now we were explaining about a family and the relationship between or inside the family members, while Echo Map explains the relationship of that patient and his family to the society. So that is a representation of how this family is connected to a society. So this is where we find how much resources or how much support they are getting from their society. Okay. So it is a pictorial representation of patient's family in its social environment, like relationship with the larger society. A small snapshot view of important interaction of patient's family with other systems like groups, extended families, individuals, organizations, associations, etc. Okay, and this was introduced by Anne Hartman. Fine. So here, like the social groups can be either be health service, neighbors, workplace, government service, community services, religious institution, friends, clubs, school, volunteers, etc. So this is the pictorial representation of an echo map. Same as earlier, like the darkened lines explain how much deeper the relationship. The dotted one is just an intimate or a close ones, and the scribbled line shows a hostile relationship. Just focus on the arrows because here we can see that arrow is pointed to either a member of the family or the whole the family. Just focus on from where to where the wave of the line or the wave of the relationship is going on. Okay, so yeah, anyone can explain this echo map? Just focus on what kind of line is and from where to where the arrows are being shown. Anyone?
They have a hostile, stressful relationship with the neighbors.
Okay, so here, like we have to focus more on the arrows. So from where to where is the hostile relationship? Is from the
Neighbors,
family?
no,
Yeah.
neighbors are having a hostile attitude towards the
Yes.
family.
Yes, yes, yes. So the hostile relationship is from the neighbors to the family. Okay, yeah, move on, carry on.
Self-help groups are having a positive relationship. I think people are coming to help them.
Okay,
They are not,
coming to help
they may not
whom?
be
Is it the
the
whole
family,
family or to the patient only?
to the patient only.
Yeah, yes. Next.
Panchayat members, that is a weak relationship, but to the family.
Yeah.
Volunteer
It's
group
not that
also.
much close and that much it's a kind of high by or a kind of a weak relationship. They're not in such a close relationship with the particular family. Okay. And what about the church here?
Church, they have a very strong, they are also involved. Church members are also very much closely involved with the entire family.
Yes, with the entire family, they are very much close. Okay. Yeah. Coming to the volunteer.
Volunteers are having a positive, normal relationship with the entire family.
Yeah. Youth
Youth
organization.
organization. So youth organization.
Good rapport with the children, ma'am. College, youth organization, having a good rapport with a patient's daughter and son.
Daughter and son or daughter alone?
Yeah.
Is it with the daughter?
Daughter alone.
Daughter alone.
Yes, yes,
College
yes,
with-
yes.
And college with son alone.
Yeah, from the college to the son alone, they are having a very good relationship. Yes, good. Regarding the school?
School with daughter, good, okay relationship with school.
Yes.
And friends both together.
Friends are both with the daughter and son.
Yeah, friends
Daughter and
are like it's like two-way their relationship is going, like from the friends to the daughter and from the daughter to the friends. And same is happening with the son also. Same two-way relationship is with the son also, like friends having a good rapport or good relationship with the son as well as vice versa. Okay.
Yeah.
And public health center.
Um, with the medical facility, I think for we speak with the patients, like public health center. I don't know whether the approach is not much with the health center.
Yeah, they are having a weak approach, but it is to the family whole or to the particular patient.
It is not
Yes.
a family role. It's towards the patient.
Patient, yeah, to the patient, their public health center is not having a very good. It's like a weak kind of relationship. And colleagues, the last is the colleagues.
Colleagues, two
To the
ways.
husband.
Yeah,
Two-way.
it's a two-way.
Repo is the colleagues of the husband's colleagues there.
Yes.
So they have connection with.
Yeah, okay. So it's a two-way relationship and it's a normal kind of relationship. Okay. So I think it's clear. Do we need a more explanation on this? No. Okay. Okay. Thank you. So who's a caregiver and what is a caregiver? So this is the definition or statement said by Rosalind Carter. So here, in her words, she explained caregiver or she categorized caregiver into 4 sets. And she says that in this world, the people can be divided into this 4 kinds. One, who have been caregivers, like they have been caregivers in their lifetime. Somewhere they have been a caregiver. And the second set of people are the ones who are currently caregivers right now. Okay. And the third set of people are the ones who will be caregivers in future. And the fourth set of people are the one who will need a caregiver. So in which category we belong to? So some way we may have been a caregiver before in our life, or we are the ones who will need a caregiver in future. So either any of the manner, we are also caregivers. So it is our responsibility to show equal respect to the patient as well as to the caregiver. So respect them as individuals, acknowledge them also. Simply focusing on the patient itself doesn't make any change because all these stresses are dumped onto the caregiver in any of the manner. So it is our responsibility to acknowledge their mental strength as well as their social well-being and physical well-being. So acknowledge them, respect them, and never dehumanize them by calling them as a bystander. Okay. So just think that we are also a caregiver and we also need a caregiver in future. Okay. So these are the few of the interventions which we provide in our hospital settings. First one is we used to provide them informations. We used to educate them, providing supportive counseling, uh, continuous follow-up, bereavement support, rehabilitation, facilitation, liaison. So by taking all these assessments and by identifying, like we have taken the assessment, we learned what is psychosocial, and we understood which all information has to be collected, and from that we have identified the problematic area. So after that, what we have to do is the plan or the intervention part. And based on the problematic area, we will identify which intervention has to be done from this particular category of interventions. There are more interventions, of course, there are more interventions, but based on the particular incidents or based on the particular patient, we will be providing the interventions according to them. So here we have given few interventions and that is what I have noted down here, but there are more interventions other than this also, which will be used based on the situation. Okay, so some of the interventions are have been noted it down, and like I think it's are just common interventions which all you might be familiar of, like providing the counseling, providing them rehabilitation support, educating them, and if any kind of facilitation should be happen, like providing the details or facilitating them to other sort of areas where they need informations like that. Okay, So it's time for the case study right now. I will be explaining the case study, and we will be going through each aspects. Okay. So this is a 56-year-old lady, Mrs. A, has been diagnosed with CA breast in 2016. She has undergone mastectomy, breast removal surgery. She was referred for pain management. She looked very anxious and has no idea about palliative care. There are also comorbidities, which is diabetic since 12 years, coronary artery disease is there, and also she had gone through a fall in 2019, and due to that, she had a fracture on leg. She's a widow, and her children are having a hostile relationship with her children, and she's also living alone in a rented house. So this is the case study of Mrs. A, and my question is, what all socioeconomic problems will this patient be undergoing? By reading the case study, you can either unmute and say or just put in the chat box. What all socioeconomic problems will be faced by this Mrs. A?
Ma'am, she's going through all the aspects, like physical also she's having, as she's in a pain now after her surgery. Secondly, because of a hostile relationship with her children. So she is
Yeah, she is
emotionally
definitely going to all the aspects, but right now we can focus on what are the socioeconomic aspects or what are the socioeconomic problems. Can you please list out the socioeconomic, few of the socioeconomic problems?
Yes, social, like she may be having a financially problem, she'll be going through her family now because as a relationship with her children is hostile,
Yeah.
not good relationship. So
Okay.
she's emotionally disturbed. She's like she will not be able to bring out her with what she's going through it. Like more than a physical, she's mentally means like mentally she's more depressed and all. She'll be
Okay.
going.
Okay. Okay. Any more points to add on this regarding the socioeconomic aspects? Expensive treatment. Yes, she's having comorbidity. So of course, multiple illness are there again, which will be like adding more stressors to the treatment part. Of course, financially she is in. She has to depend on someone. And single mother, yes, she is independent, and there is no support system from any of the social groups. So that is also one of the social problem which she is facing on. And any more socioeconomic, do we have missed anything? Okay, now we can go to the physical part. What are physical problems will she be undergoing? Pain.
She will
Okay.
have pain.
Yeah.
Yeah, she is handicapped as such, we can say. Mastectomy is done. She may have lymphedema.
Okay.
Plus she had a fall, so that also added to that.
Okay.
She lives in a rented home.
So rented homes comes under the socio-economic issues. Okay. Uh, does she have an insight about her illness? Do she?
Think no, because she is having no idea about palliative care.
Yes. So that also can be added to the physical aspect because she is having no idea about what palliative care is. So her insight regarding the illness also is zero or no. Okay, so we have covered the physical aspect right now. Coming to the spiritual aspects, what all concerns will be she facing, or what all thoughts will be undergoing regarding the spiritual aspects?
Maybe she is blaming herself for why it is happening to her, or she may be blaming to God.
Yeah, like she's blaming to God. Why is everything happening to me? Because she's a 56-year-old right now, and
Yeah.
it's been 12 years she has been got with this diabetic. So these multiple illness or comorbidities have been happening at her younger age itself. So it's a continuous process, and which she is facing on. So obviously she will be having the question of why me.
Why me?
Okay, and anything, any other concerns, any other spiritual concerns which she will be facing? Fear of disease condition, only me. Okay, that also explains why me question. Anything else? Desire of death than being suffering.
She's
It's better to die.
Fear of death also. Nobody is there.
Nobody is there. So I have
she's
to
a
suffer
widow.
like this? So such kind of spirituality concern also may arise.
Giving away soon.
Giving away soon, yes. Desire to die, or her thought of being uh, losing a life like that. Okay, coming to the psychological part again, what all concerns will be there? I didn't hear you.
Loneliness. Loneliness.
Loneliness. Okay, yeah,
First
loneliness will be there. Yes.
hostile relationship with their children.
Hostile relationship with her children. It's written as she looked very anxious. So obviously she will be having that anxiety regarding the illness as well as
Depression
regarding
also
her
will be
life.
there.
Yeah, there are symptoms of depression.
Agitated. Different. There will be some kind of agitation also because fear related to disease.
Okay, yeah, agitated behaviors can be present in this particular person.
Sleeplessness.
Some sounds are coming.
Sleeplessness.
Sleeplessness. Okay, yeah, this person's may going through sleeplessness. Okay, I thought like somewhat we have covered based on the four aspects. Now we can have a small go through, like is anything need to be added or not. So based on the physical aspect, she is having physical pain, which we have told. Fatigue is there, lack of sleep, difficulty in walking. We missed that. Like since her leg is fractured, she is having difficulty to walk. That means that she has to depend on someone, and which is lacking over there, where she is socially independent. Okay, body image issues as if she has gone through the mastectomy. So that comes under the physical part. Psychological one, isolation, emotionally weak, anxiety about future, unclear about the prognosis and palliative care. She is stressed due to multiple illness. Then socioeconomic part, she's having a strained relationship with family. She is independent and she's not been able to go for job also. Like financially she's unstable, her house rent has to be paid. That also is again adding stress to the financial aspect. No accessibility to the hospital and absence of caregiver and support system. So these all comes under socio-economic categories. And spiritual part, extreme spiritual distress is being found here because of her sufferings. From her sufferings she is having a extreme distress. She has lost faith in God, she has lost connection with the family, there is no significant persons in life. So at the end, what is seen that she does not have that meaning in her life. She's not been able to find the hope, meaning, and joyful in her life, which depicts that she is on spiritually great stressed. Okay, so this is how we chart, or we can say that this patient is under total pain based on the 4 aspects. So here we haven't considered only the physical part, but other 3 aspects also are there. And somehow, somewhere, the 3 aspects are being slightly higher than compared to the physical part, but altogether makes the total pain. Okay, so a clear picture of how or why psychosocial is important in palliative care, and how much it is important, and how we have to go through the psychosocial assessment part. We have to identify all these areas, like what all things are lacking and what all things are she is more concerned of. And based on this, we have to find the resources. If there are some areas which has to be strengthened, like her emotional well-being, or if it is a mental well-being, we have to strengthen that part. We have to find sources for her financial instability, and through all these parts, we will be having a perfect intervention plan through which we can reduce the total pain of this particular patient. So I hope you got a small idea of what psychosocial, how it is important, and how we can assess it, how it will be fruitful for the patient. Any doubts or queries in that? Okay, so just few points which you have to always keep on mind. First one is evaluate our interventions. Just providing a plan or intervention does not make a full stop there. We have to evaluate whether these interventions or the plans which we have produced is being benefited for the particular patient or family. So evaluate our interventions which we have provided, assess how the patient and the families are benefited through our interventions, whether they've been benefited very goodly, or is there anything which we have to modify. So assess on how they are being benefited. And assessments has to be revised and updated, because as per the routine or as per the interventions, maybe there are few areas which we have missed out. So that can be addressed only when we are doing the reassessment, and only when we are updating more on the particular patient's history and their lifestyle. So do assessments now and then and make it updated every time. Reach out for help. And if you find that, okay, somewhere, some point, we are not being able to find a solution, and you think that there is something which has to be referred to, reach out for help. Do go for the better, like that authorities or that people where we can put a correct solutions to that particular patients. And there is an art and science in every psychosocial care, just as in medicine. So with this, I conclude the topic on psychosocial aspects in palliative care. I hope you might got a small idea on what psychosocial is, and if there is any clarifications, you can come out, like unmute and ask the questions, or just put on the chat box. Hope everyone understood, and thank you for the good session.
Thank you, Neeraja, for the wonderful session. Anybody have any doubts?
Thank you, ma'am. Presentation, hearty presentation.
Thank you, ma'am.
I hope presentation is clear to everyone. We can move on to the case presentation part. Ms. Dosama ma'am will be presenting a patient story today.
Okay.
So,
Thank you.
Can I start, ma'am?
Sure, please.
Good afternoon, everyone. My name is Rosama Joseph. I am working at T. John College of Nursing, Bangalore as a professor. Today, I would like to share a patient story with you. My patient, is a 37-year-old male, diagnosed with acute CVA. The presenting complaints of the client was slurred speech, deviation of the angle of mouth, right hemiparesis, difficulty in swallowing, and urinary incontinence. History of complaints, while the client was traveling in a bus, during that time he had a sudden fall, and when he was brought to the hospital, his speech was slurred, he couldn't move his right arm or leg, and he was not able to follow the instruction. He was confused, his legs were deviated to one side, he was having weakness of the right arm and leg, and he was having difficulty in swallowing. On examination, the client was conscious, he was oriented, but he can move his right upper and lower limbs. And in the hospital, his bladder was catheterized due to incontinence. He was having dysphagia, and his vitals were temperature 98.6 degree Fahrenheit, pulse 87 beats per minute, respiration 17 per minute, BP 125 bar 82 millimeters of mercury. Investigations, blood investigations were done, CBC, LFT, RFT, all of them were within normal limits. And the CT scan showed left CG blade. Treatment included, as the patient was not able to have any food, patient was on NG feeding, and due to the incontinence, bladder was catheterized. And medications included injection mannitol 100 ml IV QID, peptidogrel 30 ml TID, injection pan 40 mg IV OD, and injection MSF 4 mg IV OD. Regarding the psychosocial aspects, 37-year-old laborer, father of 3 children, aged 7, 5, and 2 years. He was from West Bengal. He came to Bangalore for a job, living with other workers in the rented place. Family is living in West Bengal. He is the only breadwinner of his family. Was initially admitted to a private hospital, but the expenditure was more, so he had to leave that hospital. And he was brought to the government medical college after 2 weeks. He is a devout Muslim, and his wife and brother is taking care of him here in the hospital. His children were left at his parents' home, so they were taking care of him. The main concerns include immobility, dependency for ADL, and the financial burden. Already he was not able to pay for the expenses from the private hospital, so he had to be shifted. And being a devout Muslim, he was feeling very sad why this has happened to him, and the fear of future. What will happen to him if he cannot go for a job? How can he pay for the expenses? Inability to communicate properly, and the chance for gut sore. Summary: 37-year-old male manual laborer developed acute CVA, is the sole breadwinner of his family, has right hemiparesis, slurred speech, dysphagia, urinary incontinence, has 3 young children to be taken care of, and his family is located far away. Coming to the discussion points, what are the psychosocial issues he and his family is faced with? How can we support the client and family? And what are the points to be taught to the caregiver?
Thank you, ma'am, for the wonderful patient story presentation. I hope this presentation is clear to everyone. We can move on to the discussion points. So today we have learned about psychosocial issues. I think you are the persons to tell us what are psychosocial issues he faced with. So now we are expecting your answers first, and then we will add. Please suggest something. We need to help Rosamana. So she came with the discussion points also. So please suggest something. We all nurses, please unmute yourself and talk, or you can put your answers in the chat box. Neeraja, so okay.
So I think this is a clear case for today's discussion, I think so. So as Shiva ma'am said, I would like few of the comments from your side, and based on that, we can go forward for the discussion. So here we can, it's like it clearly depicts like this family is going through some sort of psychosocial spiritual concerns, and so yes, may I get few suggestions and so that I can also continue based on that. Firstly, we can go for the psychological part. So what are the problems based on the psychological aspect this particular patient as well as his family is going on? Anyone?
Please go back to the psychosocial issues slides so that everybody can see. So this is the psychosocial aspect, psychosocial issues slide. So please read this and tell us what all problems. We all know that this patient need a total care, right? Physical care, emotional care, social care, and spiritual care. So, as Neeraja ma'am said, this is the apt patient for today's class. Okay, so we need to discuss. Then only we can able to understand well.
So here on the first sentence itself, we can see that there are three children with 7 years, 5 years, and 2 years, and the father was only the breadwinner. So since he was diagnosed with this disease, obviously these children's education will be affected. So we have to assess, does there is a educational issues faced by the children, and whether we will be able to find any resources so that these children can be helpful with. And yes, someone mentioned that there is some financial issues, like overall there is financial issues, because we can see that due to that only this person got shifted from private hospital to the government hospital. So is he is getting any government provisions, like whether they are getting whether they are aware of any facilities from the government? If there is not, then we have to provide such kind of educational part, like facilitating this person and this family with local government, and also the provisions what they are being need of with the from the government. So for example, like coming to a government hospital, with the limitations they can get, like with the, if he's or she is having any ration card or something like that, then they will be getting provisions based on that, like medicines with uh, like discounts, such kind of things can be happen. So we need to explore, like based on that, whether they are aware of or they are getting anything, or they are people who comes under that category, and if there is, we can facilitate this person and this family to such kind of facilities. And here regarding the other support systems, like the relatives, the neighbors, also like is there any colleagues or other systems who are not about the condition of the patient? And if not, we can have a communication with them, telling them more about their patient's condition and seeking whether there is any support system which we can provide to this particular family. So based on these small ways, we can give a financial support to the patient and as well as for their family. Any other comments which we can add to this based on the financial aspects? So here it is shown that this patient is having a main concern based on the dependence on ADL. So in that, what we can do, like what you can suggest on that area. Also on immobility, like obviously he was a healthy person, and now he's been able to, or he's having that thought of I have to get support from other people, or I need to depend on other people. So on that particular area, what can we do, what can we work on that? Any suggestions on those two ideas, like immobility and dependency for ADL activity?
Like rehab can be done, ma'am, like involving physiotherapy or occupational therapy, and plus like on and off counseling of the patients, like he can keep his courage and can try to come out from these things. Means physically, like occupational plus physio plus like rehabilitation. So like wheelchair on a, if he can able to sit on a wheelchair and trying with his other hand trying to do something, like, but this has to be contacted with the rehab people's, like.
Okay, anything else, if anyone want to add? So here, one more thing we can focus on, like all the time, it will be his wife who will be supporting him. So there is a chance of caregiver burden in this particular case. So for her support also, we can add the neighbor system. Like suppose if there is an emergency of shifting this person to a hospital. So on that time, if there is a good social system, that is a good neighborhood network is there, then they can be included, which will provide social well-being support as well as will reduce this caregiver burden. So such kind of activities can be done by involving the social areas or social groups into this particular patient's treatment. So that again will be helpful for the physical aspects as well as for the social aspects and for the caregiver burden. Okay. Anything else which we can add more on it?
So, can I add something? Neeraja?
Yes, ma'am. Yes, ma'am.
Yeah. So, as Neeraja ma'am said, before he was a healthy person. Now he is not able to do his self-care, at least self-care is not able to do. So that is affecting him a lot because the emotional problem. He always depending others, at least a glass of water. Even if he wants to get up from the bed, he needs other support. So that will be affecting the patient emotionally. So what we can do is, one of you suggested earlier, rehabilitation, physiotherapy. Here come our teamwork. So we need to involve a physiotherapist in that patient care and give a proper physiotherapy and make them independent as much as possible. So we can able to relieve the caregiver burden also, if it is possible. If that is happened, definitely we can able to prevent the caregiver burden also. So we have to empower the patient and give a proper physiotherapy so that we can able to make the patient independent. So that is one thing. And financial problems, we already discussed about that, and we can connect with the nearby palliative care team, or maybe we can find out some maybe donation or something like that. And also we have to think about the physical rehabilitation, occasional rehabilitation, and education rehabilitation. Here he has 3 children studying, not able to continue, sometimes not able to continue the study because of his illness. He is not able to find out the money, lost his income. So that will be affecting the patient emotionally. Because of my disease, my children are not able to continue my study. So that, if possible, we have to find out the donors and try to continue the children's education. So that if you do like that, definitely that will be giving some sort of relief. Okay, even I am here, this kind of thing, but bound also somehow they can able to continue the education. So, and also vocational rehabilitation. You have to think about the vocational rehabilitation. Give some thing about that. I think Neeraja ma'am will be talking more about that, about the vocational rehabilitation. So that kind of thing you have to think. Always you have to putting yourself into that place. Always. We need an empathetic mind. Okay. So you have to think about the patient side and the caregiver side and plan accordingly and implement. Okay. Thank you.
So as Shiba ma'am said, this is a particular case where we all the four aspects has to go parallelly, one hand together. So focusing only on just one aspect doesn't work because all concerns are based on all the four aspects. So it should be go in a in a mutual way. Everything should work on a mutual way. And here the next concern was written like there is a spiritual worry for this particular patient. And like Sangeet, can I go to the previous slide? So here we can see that he is a 37-year-old man, and he was a very devotee, like Muslim devotee. So obviously his mind will be asking, I was a perfect devotee, and I'm on this younger age where I have started my family with my children, and I have done all my prayers and all my offerings to you, and then why this has happened to me? So like all these concerns are making him question like why me? So we have to explore on those feelings of him, like why questions is arise from what sort of feeling? Is it from his family side, or is it from his devotional side, or is it due to the experience, like previous experience what he had undergone, or since I have done too much goodness, still a negative has occurred to my life? So we need to explore more. For that we need to have that empathetic side, what as ma'am said, like because no one will explore their feelings and emotions to a person who is non-empathetic and who's not ready to hear to these worries of a person. So we have to sit with him, we have to go through a detailed communication and sessions where we open up all his concerns and all his thoughts regarding his worries, because then only we will be able to identify what exactly the problem is. And here, like based on the spiritual concern and all, we have to have a like deeper communication with him where he like ventilate all his emotions and feelings, and that itself will give him a very good therapy. That ventilation itself will give him a very good therapy, and from that identify where we can strengthen his mental health, like which source can be strengthened, which area can be strengthened, motivate on that side. Along with that, parallelly going to this physiotherapy, like reducing the caregiver burden, finding sponsors and sources for this financial aspect, all these together will make a meaning to his, make a meaning even in this limitation. So I think getting or collecting all the informations and working parallelly can help this person, I think so. Whether it be on the physical aspect, whether it be on the psychological aspect, spiritual or socio-economic, try to identify from him itself through the empathetic communications and conversation with him. Okay. So I think I have covered, and anything to add on it, ma'am, Shiba ma'am?
So I think one more thing, the main concern is he was not able to communicate properly because maybe the right side hemiparesis is there. So that Broca's area is left side, so speech is also affected uh, to the basic patient. It seems to be, I think. What we can do is, in this case, the emotional exploration is very, very important here. But inability to inability to communicate properly is the main problem here. So, as nurses, I always said, like, we are spending more time with the patients if possible. Sit near to the patient and convey this message, like, we are here to help you. So that positive message you have to convey, so that he can able to explore his emotion, at least cry or something like that, so that we can able to maybe like give some mental relief after that happens. Definitely, if he is able to express his emotions, so that way we can able to give some sort of mental relief. So that you can do at least this stage. But gradually, we all think about the four aspects: the physical aspects, psychological aspects, spiritual aspects, and the social aspects. So we have to give attention that aspects also. First, you have to try to relieve the physical problems, and then you can include the other aspects also. But if you look into the four aspects, definitely we can improve the quality of life of this patient and their family. Okay, thank you.
Thank you, ma'am. Thank you so much, ma'am, for adding your valuable knowledge also.
Thank you, ma'am.
Thank you.
Thank you, Neeraja, for the wonderful feedback and for facilitating the session very well. Thank you, case presenter Rosana Joseph, for presenting the wonderful case presentation. Thank you all. Let's see you in the next session. Bye.
Section. Thanks a lot.